Hi, folks. We're just going to wait a little bit more, just as a few more of our attendees start flooding in, and we'll get ready in just a few minutes, a few moments. Okie dokie. Well, look, thanks so much for coming back for this final session of the NOAA convention. I really appreciate you guys spending the day with us today. I hope you've had a really good day with us. But we're saving one of the best till last, and we are so delighted to have Matt Ashton with us. Matt's Director of Public Health Liverpool, and Matt's very kindly agreed to give us a bit of his time just to talk a little bit about public health and events, specifically within Liverpool, but obviously the relationship is important throughout every event that happens. Matt's going to talk a little bit, and then again, like we say, one of the big things we want to do is give you guys unique access to our speakers. So please, if you can, think of questions. If you want to ask Matt anything, he can't answer absolutely everything, but he'll answer as much as he can. But it would be great if there's things that you want to talk about, then please do feel free. Again, use the Q&A function, or if you want, just raise your hand and I can bring you into the room afterwards. But until then, Matt's just going to set the scene with a short presentation. Matt, over to you, and thanks once again for joining us. I really appreciate it.
Thank you very much, and thanks very much for inviting me here this afternoon. It's an absolute pleasure to be here. So my name is Matthew Ashton. I'm the Director of Public Health for Liverpool. Director of Public Health is a statutory role, so we have a role around improving the health and well-being of our population. But that isn't something we do by ourselves. It's something we do with, for, and through other people. I mean, health and well-being is such an enormous topic that it just wouldn't be possible for me just to buy a few services and improve health in that way. So it really is around the concerted efforts of everybody in the system. The first thing I want to do is pay tribute to you guys, to your industry, for the difficult time that you've had over the last 20 months and the incredible work that you've been doing to try and rebuild the industry. You know, the events industry is essential, it's enormously valuable, and of course you give people fun, you give people enjoyment. So it's incredibly important we remember that and hold on to that. So thank you for everything that you guys have been doing. So I have got a short presentation to go through. I want to start off by saying that I believe the events industry is absolutely crucial for our local economy, and no more so in Liverpool, actually, where the events industry, the hospitality industry, makes up almost 50% of our revenue. So very valuable. But as we all know, the COVID pandemic has affected the hospitality industry, the events industry, incredibly badly. And I think it's essential that public health works and continues to work with the industry to support you guys to operate and to recover. I want to make the case that public health and events go hand in hand, and that we have a vested interest in supporting each other, whether that be around a pandemic, the worst pandemic in over 100 years that we're in now, or other infectious disease, or whether it's around alcohol and drugs, or whether it's around sexual health, or whether it's around community well-being. I think we have opportunities to support and enhance each other's offer. But when I make that case, I'm just going to go back a little bit first. So in Liverpool, we had this. So we all know the way the pandemic's affected us all, you know, from kind of March last year. But we had the second wave of the pandemic in September, and we were one of the first areas in the country, Liverpool and Liverpool City region, to have high and escalating rates, and we were put into enhanced measures before the second national lockdown. And so we were very concerned about that for all kinds of reasons, not just from a health and well-being perspective, but also from an economic resilience perspective. So we worked very closely with the government to explore what mitigations could be put into place, what innovation we could be trying. And one of the ones that was offered to us was mass asymptomatic testing, or lateral flow testing, as it's more commonly known now. As you're probably aware, we were the first area in Western Europe to utilize that mass testing. And we ran that out from 31st of October. By the 6th of November, we had 6 sites, then 16 sites, and then up to almost 50 sites operating mass testing across the city, which we ran for an intense period of 6 weeks, where we did a lot of learning around how mass testing could help reduce the prevalence of the disease. And that learning was taken into the model nationally that's currently used nationally. But what we also saw was that actually we saw a 21% reduction in the number of cases of COVID in Liverpool and in the Liverpool City region over that 6-week period, which meant by the end of the second national lockdown, Liverpool exited that in a lower tier of intervention than the one we went into it at. We were the only place in the country to achieve that, and actually meant that our population had a hell of a lot more freedom than many people in the rest of the country, and our economy was able to bounce back. And in the run up to Christmas, lots of activity was allowed to happen that perhaps otherwise wouldn't have been allowed to happen. And I make that point to show that, you know, that was a very valuable experience for us. But we actually treated mass testing like an event. We have incredibly skilled events people in Liverpool. It's what we do. We are brilliant at putting on events. We do it very well. And people in Liverpool love going to events. So we treated this like an event. Our Culture Liverpool team helped us organise the venues, the staffing, the engagement, any accessibility issues we were having. And actually, we put on a really good show. So very, very valuable. And as I say, there was an end product to that. It put us in a much stronger position going into winter. And one of the things, and this is probably won't appeal to everybody in the room, but you can see the middle picture there is the army doing mass testing at Anfield, actually at the home of Liverpool Football Club. And one of the things we saw was that we were one of the few areas, therefore, to be allowed to have home supporters at football grounds in the run up to Christmas. And I remember vividly the last home game that fans were allowed in. We had around 2,000 allowed into both Goodison and at Anfield, and Liverpool beat Wolves 4-0, I think 2 weeks before Christmas. And showing the value of having supporters, fans, the general public at events in the period after Christmas, when we went into the third national lockdown and fans weren't allowed in until pretty much the end of the season. Liverpool didn't pick up any points really for the rest of the season, so it had a massive impact on Liverpool. So building on that learning, we were advocating very early of the importance of the events industry in Liverpool to the city, and we were again really closely with the government to try and advocate for us being a place where we could relaunch events safely, taking the learning from mass testing, using our partnerships that we developed with people like the army and our universities and our health sector. So we work closely with government to try and make that case really from October to position ourselves to be in the best possible opportunity to take advantage of any events relaunch. And that's where the events research program came from. Now, the events research program was a national program, but Liverpool had a number of events. These ones on the screen here, the Good Business Festival, with 2 nightclub events on a Friday and on a Saturday night, and then on the Sunday, a big music festival in the middle of Sefton Park. Now, this was iconic, really, to be relaunching events in this way. It attracted a hell of a lot of attention from people. The eyes of the world are on us, so it was essential that we did that properly. Now, we did that through partnerships. It was a public health working with our events sector, the amazing events partners we had locally, our Culture Liverpool team, our health partners, and also our university colleagues to make sure we could evaluate it all properly. And I just want to paint a little bit of that picture for what it was like. Now, I went to every single one of these events. Crucial part of my role, but I can't deny there was a bit of fun around it for me too. Started off on the Good Business Festival on the Wednesday afternoon, and there was around 350, 400 people in attendance. And prior to this, the world had been pretty much shut down. And so there wasn't lots of people gathering in places. So the thing I remember about walking into the Good Business Festival was how loud it was. People were together for the first time in a long time, were loving seeing each other for the first time in a long time. And there was lots of noise in the room. It was quite emotional seeing it. I went to the nightclub events on the Friday and on the Saturday, and walking in on the Friday, the thing I know I don't look it, but I'm a little bit older than the usual audience for nightclubs, and the thing that kind of I really saw on the Friday was people having fun, young people having fun, their eyes kind of wide open with the fact that they're going to be going in, being able to dance all night, and it was an absolutely incredible experience because there was just nothing but joy on people's faces. And then we had the over 5,000 people attending the music festival on the Sunday in Sefton Park, with the Blossoms headlining, with the Lathams supporting a local artist supporting them. And again, a phenomenal experience, kind of slightly older audience, but everybody kind of rushing to be in there, rushing to enjoy themselves, and absolutely abiding by the rules, doing what they needed to do to go to live events because people wanted to be at live events. And it was an extraordinary experience seeing the backstage operations, seeing how much attention to detail went into the planning arrangements and to getting it absolutely right, because as I say, the eyes of the world was on us and we couldn't afford to get this wrong. Enormously proud to have seen all the bands, including the Lathams, who subsequently and most recently had a #1 album. So I think we did good for the artists as well. But obviously, it's not just about the pretty pictures. There's an enormous amount of work that went into putting those events on. Usual events planning is hard enough, let alone without the added restrictions and planning that was needed around COVID. So a couple of themes that just to draw out here. So we had to do a lot of work on the protocols and the methodology. We had lateral flow test and a PCR test before attending and a PCR afterwards. Only the first lateral flow test was mandatory, but obviously the PCR tests were strongly encouraged. We had to work very hard on the availability of the testing infrastructure. So where could people go to get their LFT tests and to get their PCR kits? We did a lot of work on matching up ticketing and testing, and this is something the industry's been grappling with for the last 20 months. We had workarounds. So actually, by the end of the week, we matched around 95% of sold tickets to negative lateral flow tests that people had taken because of the data sharing agreements we had in place. That was hard work and a phenomenal achievement, but we had workarounds in place for the 5% of people that we weren't matching. The processes needed to be tested in real life, and we did that on the Wednesday in the Good Business Festival and had refined the processes by the time we got to the nightclub events on the Friday and Saturday. But we also had backup procedures in place to identify and eliminate any positive cases that were coming through in case people tried to game the system. So get tested, got a positive result, but decided they were going to try and attend anyway. We had automatic cancellation of tickets if there was a positive test with refunds, but we knew that wasn't automatically going to be enough. Lots of work on the entry and exit procedures to make sure it was as safe as possible, including several layers of showing and asking for proof of that negative lateral flow test, and making sure that people were trained up to know exactly what they were to ask for and how to deal with any conflicts that arose. Staff safety is an enormously important part of this. It isn't just about the people attending. So making sure that we had people using face coverings, had protective shields, we're using appropriate infection control measures, and also having negative lateral flow tests, because as employers, it's essential that the industry keeps their staff safe and also contractors who might be on site. Comms and engagement, as I'm sure you'd expect, was enormously important here, because we had to have everybody with us. It was hearts and minds. We had to have really clear engagement on what the rules were, but not just led by the council, because who listens to what councils say? We had to do it through our partners, through our artists, and through our community, and it worked. The buy-in was unbelievable. As I say, everybody wanted to go. So comms engagement had a crucial role in explaining the journey and the requirements for event goers and for liaising with the media as well. There was lots of comms resource required before, during, and after events. It was very intense, but a hell of a learning experience. And we also had to respond to a lot of social media misinformation to make sure that we were getting the facts out as quickly as possible. We had an overarching governance process on this to make sure that we were doing the right things and that everybody was in agreement. So we had sign off through the JAG and the SAG processes, council processes that I'm sure you're familiar with, but also a council gold COVID response meeting that we had with chief exec and with wider partners to make sure that those governance arrangements were really clear and everybody knew what we were getting ourselves into. I think it's worth saying the interface between national and local was complicated. So there was lots of late night conversations, lots of discussions about how we were doing this and whether we were doing the right thing and whether we were doing the right thing in the right way. But we were clear that local decision making was key here. This was about doing the right thing for our industry, in our patch, for our community. And in terms of impact, so only 12 people were found to have the COVID virus from all those events, from the kind of over 12,000 people that attended those events, only 12 people. And half of those, based on the contact tracing information that we followed up with afterwards, half of those were likely to be as a result of mixing outside or before the events. So really, there was no detectable impact on COVID spread in the region. Now, that doesn't mean that there wasn't a risk of COVID. It doesn't mean there wasn't any COVID. It just means there was no detectable impact, and it likely means that the mitigations we put in place were effective and allowed us to run safe events. So again, something we were massively proud of. There was some challenges with getting the post-event PCR returns because there was no real incentive or motivation for people to do that. Once they'd been to the event, they'd been to the event. But we got up to 43%, I think, for the Sefton Park event, which we were quite pleased with some incentives about being entered into a prize draw for future events. Context is important. The infection rate at this time, April, May last year, was lower than it has been at its peak, lower than it is right now. And we also didn't have the Delta variant, which is much more transmissible, much more infectious. So it's not directly comparable, but the measures, the protection, the mitigation measures for COVID are the same, regardless of infection rate and regardless of transmissibility. You know, they're just sensible things you do to keep people safe. And the other thing, of course, was that vaccine rollout was only really kind of starting, and it hadn't got down to the younger audience that most people who were going to the events were. Definitely some key learning from our events. People wanted to go to events. They still wanted to go to events. And we also strongly feel it's entirely possible to run high quality COVID safe events. But the thing that made that possible was the partnership working between public health, between our culture team, between the events team, between the industry, and with our academic partners. And public health involvement in that was key. We don't run the show. We're not experts in events, but we are experts in public health. And there's something about how we use expertise there in the right place. Event organization is essential. And I think, you know, the more effort you put in, the better quality events you get out. We used ticket holder feedback and event organizer feedback to refine the process, and that's fed into our ongoing events planning. And similarly for communications and engagement, we want to be an event city. We are an event city, but it's important that we promote Liverpool and Liverpool events on the basis of we know what we're doing and we know how to put on safe events. And as I said, you know, governance is absolutely essential in that piece as well. So I've got some thoughts on the future for events, and it was really interesting listening to the previous debate. And you know, there's no one better than the events industry for embracing change and challenge, and you've demonstrated that over the last year. Public health now has a stronger presence in JAGs and SAGs and local authorities, and we are asked, rightly so, to provide public health advice on events. And I think that's a good thing. I think we have something to offer, something to bring to the table. I was reviewing the terms of reference for our local SAG yesterday, and in the membership, it says public health to be invited when you need to. And we have basically revised that to say public health is core membership now. We don't know what's happening with Plan B, with the much heralded and talked about Plan B, but no sign of movement on it. We don't know. But what we do know is that there are steps we can all take to keep events safe. And the more that we keep events safe, the more likely they are to remain open for business. The good news is the COVID-19 pandemic will end. All pandemics end, but other public health risks remain, and other public health risks will come along. So my view is it's essential that risks from infectious disease and from other public health risks are treated in a similar way to health and safety risks. And if we do that, and if we work together on that, we can put on really good, high quality events that will be the envy of the world. Because, as I said at the start, the events industry is so important to all of us. It's so important to the economy, but it's so important to us as humans that we can have fun. This is about mitigation of risk rather than elimination of risk. So there's some very practical and pragmatic solutions to how we run safer events. There's a reminder, I think, from the 1918 flu pandemic. The Roaring Twenties followed the 1918 flu pandemic. There will absolutely be an appetite for people to go out and enjoy themselves. And we just need to make sure that we embrace that, but think about how we improve the industry for the better, make it bounce back stronger, make it bounce back better, and make it contribute towards some of the inequalities challenges we're going to see as a result of the pandemic, particularly around mental health and well-being. I think what I would say is sometimes the debate is seen as health versus the economy, and health or red tape getting in the way of the economy or the industry doing what it needs to. And I don't see it like that. I see very much that they're both two sides of the same coin. If we have good events with healthy populations attending them, we'll have a thriving industry and a thriving economy. It won't happen overnight, but there are huge opportunities for us. And the more that we work together, the more I'm certain we will unearth those opportunities. Thank you very much. I'm very happy to take any questions or follow up from that.
Brilliant. Well, look, first of all, Matt, on behalf of everyone from NOAA and everyone on this this convention, I'd like to say thank you. That was a lovely presentation. Thank you. Really, really informative. And I think I'm not an event organizer myself, but I do know that event organizers love nothing more than people that like events as much as they do. So thanks very much for your passion towards what we do as well. It's really appreciated. I'm going to invite people to raise their hands or put in the Q&A questions as we go along. There's a few already coming in as we go, but just to set the scene, Matt, just really interested. Someone's already asked, do other public health people like yourself think like yourself about events? How much of an outlier is Liverpool?
I think it's fair to say that we probably are a bit of an outlier, but I think directors of public health will get on board pretty quickly because, and it will depend on local context, but because events are massively important to us all, and it's a sign of life returning much more back to normal. The challenge is probably more a capacity one to respond rather than a capability or a desire to respond, if I'm honest. But I think I probably would say this. Liverpool likes to lead the way.
Fair enough. And a sort of a follow-up question around that actually is and again, there's a difference between liking but having experience within one. There's a question here which is, do public health officials, directors have as much experience as events, and can we in the events industry perhaps help them to gain that experience?
Yeah, I think that's a great question. And there's a reality. Different people have different personalities and enjoy different things. And as it happens, I'm a bit of an events person, and I like going to events. I like doing things. So I am very interested in this part of my job. Other people probably won't be. And therefore, you're absolutely right. There is opportunities for us to, any event, identify who the local director of public health is, who the public health team are, and kind of make those connections and just work with people, open up the dialogue, ask how we can help each other. I always ask, how can I help you? And then I'll tell you, quite candidly how you can help me. That's how life works.
Fantastic. I just want to sort of address a question that's coming here about the pilot events. I'll read it verbatim. It says, without financial support from local central government, would any of the pilot events have been financially possible? Is it realistic to repeat these measures in the future?
So there's a few points on that. So the events had to be financially sustainable on their own feet. So the events were not subsidized themselves. They were income generating, commercial events, full stop. Now, what we did have was I didn't charge for my time. The events, the resource that we had in the council and the university to support that process obviously was new and additional resource. But the point of the events research program was to learn, was to generate the evidence base about what measures might help to reduce, to mitigate risk. So whilst all that resource won't be available in the future, you don't always need it all, because the learning about what the right things to do is largely there.
No, fair enough. No, thanks, Matt. There's a couple more coming in as we speak that I'm just catching up with. Oh yeah, here's one. Did you find that DCMS understood events and the issues surrounding them? I.e., could they just set up instantly and needed lead-in times? Or I guess the question is about sometimes we found in our conversations that the whole idea of the lead-in time to actually organize events is sometimes missed by people that don't understand the events industry. I guess there's that question, but also the wider question of the people that we deal with understanding what we do.
Yeah, so I guess there's a general comment, isn't there, about central government and the different. The central government's huge. Not everybody understands the area they work in as well as the people themselves, and that's why those partnerships are absolutely essential. We worked with some very good people in DCMS, but equally, I'm aware that there will have been people who didn't really understand how to do the task they were being given. But that's where the value of kind of local and of experts comes into it.
No, fair enough. And then one of the things that I was going to ask as well, you mentioned keeping public health involved in SAGs and JAGs and all those sort of things as well, and for that to become slightly more mandatory. I guess it came on in one of the previous sessions, which is someone called that the sword of Damocles hanging over the event. I guess that takes a certain amount of good relationships, because that can be perceived as a threat as much as an opportunity. How are you handling that one?
Well, I think it's all down to relationships. I mean, I actually think public health is about relationships with people. And if we end up in enforcement or mandation around anything, then I think we've probably failed. So I absolutely agree. Our mantra as an industry, as a profession, is around prevention. It's stopping bad stuff happening, or so getting in there early. To do that, you've got to have really good relationships with people. You've got to understand what they're trying to do and what the kind of the quid pro quo might be. So it is absolutely about working with people at an earlier stage. If it gets to the JAG or the SAG, or if it gets to the 48-hour sign-off period before an event, then yeah, I think you're right. We probably have collectively failed.
No, fair enough. Actually, there's a question that I'll ask it anyway, but it kind of hints towards this, which is how aware was the public health community of issues like those experienced at Southampton Boat Show and the impact that this could have on the industry? I was wondering whether that was obviously not a great case study of how these things could work, whether that was shared at all.
It was with me, so I was certainly aware, and so I've shared a lot of learning across DPH networks. And as you say, the events research program was much bigger than just Liverpool, but we think the way we did it was probably a bit more robust than other people, because we were determined to generate that evidence base. As I say, the events industry is so important to us. We want the events industry open. We want big events in Liverpool, and we want people to enjoy themselves. But we have to do it in the right way. And I think probably when the methodology wasn't entirely right, and when people weren't always clear on the partnerships and on the importance of sticking to the policies and procedures, that's where you get risk introduced. And the trouble is, and I think this is a comment on life more than necessarily a comment on the events industry, if we don't do things properly, we're storing up problems for ourselves. We can't pretend they don't exist. So one of the things we've had over the last 2 years is just massive disruption to our lives, and we all have a role in minimizing that disruption. So the more we can kind of keep things like the pandemic under control, the less disruption we're going to have, and the more we'll be able to get on and do the things we really enjoy doing.
That's great. I think I'll encourage more questions to come in, but this may be the last, unless something comes in while I answer it. But and it's back to the pilot events. But it's an interesting question. When Liverpool were doing the pilot events, was there a chance that they could too have been cancelled at the last minute?
Well, we had We had an event cancelled very last minute. We actually had two for different reasons. One, the promoter pulled out because they got very nervous about people conflating testing with mandated vaccination as a condition of entry, and they got quite a lot of abuse on social media, as I understand it. So they pulled out, and that was a shame. And actually, I suspect the conversations moved on significantly since then, and that goes back to my point about this was about us learning what works, what do you have to do to have events run safely. Another event was cancelled due to poor ticket sales, and that was a very specific outdoor cinema event, if I remember rightly. And I think that was much more about the weather, and the time of year just wasn't correct. So we did, in terms of planning, we had to deal with a lot of stuff and make sure the program was delivered as safely as possible, including responding to last minute challenges like that.
Thanks, Matt. Yeah, sorry, another one has come in as expected. So this is from Mark Sanemas. Mark, thanks for asking. I'll read again.